Brentuximab Vedotin with chemotherapy for stage 3 or 4 Hodgkin lymphoma. Definition: Brentuximab Vedotin is an anti-CD13 antibody-drug conjugate that has been approved for relapsed and refractory Hodgkin lymphoma. Outcomes for patients with advanced-stage Hodgkin lymphoma have improved dramatically over the past half-century. Although regional differences exist, the most commonly used frontline regimen, doxorubicin, blomycin, vinblastine, and dacarbazine, has not been modified since its original description in 1975.
Welcome to Managing Hodgkin Lymphoma. I'm Dr. John Sweetenham. I'm frequently asked, what is the role of Brentuximab vedotin as first-line salvage therapy prior to autologous stem cell transplantation? This is a really important question for a number of reasons, not least because we know that Brentuximab vedotin now has a role in post-transplant consolidation. So the question is, could it still be used prior to the transplant? Would consolidation therapy with the same agent then still have a role? At the moment, there are a number of single-agent studies which have demonstrated a role for Brentuximab vedotin immediately prior to stem cell transplant. One study in particular performed
Applications in medicine. Brentuximab vedotin is an antibody-drug conjugate composed of an anti-CD13 monoclonal antibody conjugated by a protease cleavable linker to the microtubule disrupting agent monomethyl auristatin E. It has been approved for the treatment of classic Hodgkin lymphoma after failure of autologous stem cell transplantation, or after 2 or more multi-agent chemotherapy regimens in patients who are not candidates for transplantation. The drug has also been approved as post-transplantation consolidation therapy for patients with Hodgkin lymphoma who are at increased risk for relapse or progression.
So I'm going to explain what the most common symptoms of lymphoma are, the symptoms that may come from enlarged lymph glands and what they feel like, and some of the symptoms that these enlarged lymph glands may cause locally, but also some of the symptoms in the rest of the body, the so-called B symptoms. And I'm going to explain why there are so many different potential symptoms from lymphoma. I think the key thing to remember is that many of the symptoms of lymphoma are found in many less serious conditions, so often it's quite hard to diagnose. So what's the most common symptoms of lymphoma? Well, patients often present with swollen lymph glands or lumps, and these are typically felt in the neck, in the armpits, or in the groin. But actually not all lymphomas present with obvious lumps. Sometimes patients may present with tiredness, fatigue, which is really in excess of what one would experience normally. They may lose weight, and they may lose significant amounts of weight without normal dieting. And they may experience night sweats, and these are typically...
Pros and cons. Pros: cure patients without the need for additional therapy, lowers the incidence of pulmonary toxicity. Cons: incidence of febrile neutropenia was higher than expected, increased incidence of infections.
Hello, my name is Dr. Tim Illich. I work as the Professor of Targeted Therapy and Oncology at the University of Manchester, the Christie Hospital in the United Kingdom. A question that I'm frequently asked is, what are the most common adverse events associated with Brentuximab Vedotin, a targeted antibody drug conjugate used in the treatment of CD30 malignancies? So the most common adverse event seen is neutropenia. However, perhaps the most difficult of the adverse events is the peripheral neuropathy, which in the pivotal studies was seen in around 40% of
In Ecuador, the incidence of lymphoma has been estimated to increase by 3% each year. In Ecuador, the highest rates of this pathology are found in Quito, with an incidence of 8.9 per 100,000 men, and in Loja with 6.7 per 1,100 women. Early detection in early stages improve the prognosis and response to treatment, including chemotherapy, radiotherapy, and immunotherapy. Approximately 200,000 people die each year as a result of the disease.
Lymphoma is a term used to describe lymphoid neoplasms that arise as discrete tissue masses as opposed to widespread involvement of the bone marrow as in leukemias. Within the large group of lymphomas, Hodgkin's lymphoma is distinguished from all other forms due to distinctive pathologic features. This cancer is one of the most common cancers of adolescents and young adults, but also has a bimodal age distribution as disease incidence again increases with age, while non-Hodgkin's lymphomas, NHL, frequently
Conclusion: A plus ABT had superior efficacy to AB if D in the treatment of patients with advanced stage Hodgkin lymphoma, with a 4.9 percentage point lower combined risk of progression, death, or non-complete response, and use of subsequent anti-cancer therapy at 2 years. Thank you.